question I was asked is what happens to kids with ADHD who don't get treatment as they get to be teens? It's a real passion for me and for the folks at Child Mind Institute to hear about and be concerned about kids who not only don't get treatment, but who also don't get enough treatment. So kids who don't get treatment tend to be kids who will have lots of negative outcomes. And I don't mean to be scary in the way that I discuss this, but there can be some negative outcomes in terms of holding jobs. There can be negative outcomes in terms of staying in committed relationships. There can be negative outcomes in terms of contact with law enforcement. And there are certainly negative outcomes in terms of academic achievement. So when kids don't get treatment or don't get enough treatment, as they get to be teens, and there's more and more choices teens have to make about really potentially dangerous things, I and we at Child Mind worry about kids who are not getting treatment. In fact, for example, the data show differences in driving records of teens with ADHD compared to those without ADHD, especially after the first year of driving. They get into more accidents, they get more moving violations. Even the dollar value per accident is higher. They tend to have difficulty with relationships, keeping them, both peer relationships and love relationships and work relationships. So it's really, really important not only to get treatment, but to get enough treatment. And we're not used to thinking about behavioral treatment in doses, but just as we think about medicine being in doses, it's important about thinking of getting a high enough dose of a behavioral intervention, specifically a cognitive behavioral type of intervention.